Hello and welcome to Focus on Health. I'm your host, Ruby Grostadere. Wishard-Eskenazi Health and Community Health Network recently announced a partnership that will place both systems and the city in the best possible position for health care reform and improve access to quality care for all patients. This partnership could serve as a national model for the future of public hospitals, giving low-income patients in Indianapolis more access to health care. Joining us today to talk about this partnership are Matthew Goodwine, President and CEO of Health and Hospital Corporation, and Brian Mills, CEO of Community Health Network. Thank you both for joining us.
Pleasure.
What a great idea this is. First, have you tell us, Brian, about this new partnership and what it means to the patients who access health care across Central Indiana.
Ruby, first of all, it's great to be here, and thanks for your interest in allowing us to share what we know and what we're thinking of with the public. This is a partnership for patients, and we believe that the focus here is really how do we make sure that patients have access to health care. Health reform is here. There's no question about whether this is going to be implemented. Some parts have been implemented, but the biggest piece of that happens in 1114. And personally, I think the worst thing that could happen would be that somebody who hasn't had insurance all of a sudden has insurance, and yet they have no place to go gain care. And that to me is still kind of the genesis of this relationship. That's still evolving. So, and we can tell you what we're trying to do, but there's still an evolutionary stage, and so right now not a lot's happened. But the idea is that health reform says we have responsibility to provide care and to focus on outcomes. And to focus on outcomes, you've got to understand who your population is and know the patients and their health and their illnesses or their chronic illnesses, and to focus on that front end. And we saw the value of us combining forces, because both of us have very large primary care networks, behavioral care networks, as well as a lot of coverage. And if we could do that in one fashion, whereby to the patient, to the consumer, we're one. So our idea is that a person could come into any of our sites, and as they come in, we have the same insurances, we have the same protocol, we have the same way of assessing the patient, and then from there we provide care, and we can deliver it in a variety of places, all under a similar continuum. And to do that such that patients have greater access.
So this really doesn't, they can not only access health care at Wishard-Eskenazi, I think of hospitals. You have several hospitals and several clinics, and they can access care at any of these.
They will be. I want to make sure people understand we don't have this done yet. We still have a lot of details to work out. But right. Yes, that's the goal. The goal would be that these are all branded as one. They're organized as one. We're still separate entities, but yet but to a patient that they're organized as one. Their insurance, the type of care, their ability to receive care in all of our sites. And yeah, we have several hospitals. I mean, we have 5 hospitals even in Marion County, plus hospitals outside of Marion County, and numerous ambulatory and behavioral care clinics.
How did this relationship come about, Matt? Did you go to Brian and say, Brian, I think this would be wonderful? I mean, how did this come about?
Well, we really did. Dr. Lisa Harris and I approached Brian. Brian and I have known each other for a long time. We served on some boards together, and so we've cooperated and collaborated in a number of other areas, particularly with health information technology. And so Lisa and Brian knew each other, but Lisa and I really sent an email to Brian and said, can we come and see you? And really we were very open-minded, but we thought that we knew the community is a great system. It's a great network. We have common values and common vision, and we thought there are probably ways that with healthcare for reform coming, that we can work together. They're going to be really good for our patients, and we just wanted to talk about that. And we were willing to talk about just doing some small things together, or doing something very large and very visionary and very transformative. And in the first conversation, really Brian started becoming very excited about the sort of larger transformational idea of really bringing our systems together, and we became very excited about that as well. And the more we looked at the possibilities of how this could help our patients and how this could help the city and the Central Indiana as a whole, it just made tremendous sense. And we had a lot of meetings, and I can tell you every meeting was a good meeting. Every meeting was a productive meeting. Every meeting was an exciting meeting where we saw that this is something that was very good. And so the idea really came together really quite quickly.
So this really is pretty much a first for both of the networks. I know that Wishard-Eskenazi has been involved in a lot of firsts over the last many years. So did you look at this as a first for doing this? Either one of you?
Well, I do think this is, well, first of all, community has a lot of partnerships that leverage people's or other entities' assets in a way, and we have a lot of partnerships as well. We have wonderful partnerships with the IU School of Medicine, Purdue School of Pharmacy, the Regan Street Institute, the Butler School of Pharmacy, Ivy Tech, University of Indianapolis. Lots and lots of partnerships that have helped us. And so partnering is nothing new to us, and partnering, frankly, I know it's nothing new to the community, and it's nothing new to lots of other entities in the city of Indianapolis. I think Indianapolis values partnerships, and it's a great environment for partnering. But the idea, I think, of a public safety net hospital system and a not-for-profit coming together to be prepared for healthcare reform looks like it's pretty new nationally, that other systems around the country are looking to us as a model for how you can really be in a wonderful position for healthcare reform. So in that sense, it is brand new, and we're sort of paving new ground here, and we think we're doing it in a very responsible way. In other words, under healthcare reform, scope and scale really matter because of the payment systems that are coming. And one way to address that is you can go out and build a lot of new facilities, and that's very expensive, and that could be an option, but that's not what we're doing. We're not going out and building a lot of new things. What we're doing is taking communities' wonderful facilities and doctors and nurses and programs, and then taking the wonderful Eskenazi programs that we're in 35 sites all over the city of Indianapolis, and working together so that our patients have more options, more choices, greater integration, higher quality, and ultimately lower cost for everyone. And working together to do that, I think, is just the responsible and the right thing to do.
How does this relationship provide for those patients up until now had not had a choice as to where they could receive their health care? They received it, especially the low income, they received it primarily at Wishard. How will this affect those
with healthcare reform, that's the perfect question to ask, Ruby. That's really what this is all about. So with healthcare reform, many people who don't have insurance today or any kind of coverage will have the opportunity to have coverage. And here's what we know from all over the country where coverage has expanded. We know this from Massachusetts, we know this from Utah, we know this from Iowa, we know this from Florida, other places that have expanded coverage. People then take advantage of that, particularly in the area of primary care and behavioral health. And now they have the opportunity to get that wonderful primary care, to get that preventative health, to get those immunizations, those screenings, a relationship with a primary care physician that can help you with your wellness and health and the things that will keep you from getting sick in the first place. That when people have coverage, they take advantage of that, but that creates demand on the system. And so by us working together and becoming more efficient, more productive, using our resources more wisely, we'll be able to take those existing resources and be able to see more patients and give those patients more options and be prepared for the increase in demand that we know is coming, appropriately so, with the expansion of coverage.
So the key I see is, like you just said, to give those patients a more advantage to receiving health care other places.
Yeah, really, and I agree, the patients you're talking about, but it's really all patients.
Yes.
I mean, we're really
Yeah.
saying this is really for all citizens. It really is saying, because it's changing with the government payers, it's changing with the commercial payers, it's changing in what employers offer. There's just all this change going on. And we believe we can provide this net to say, here's all the ways in which you can get to our system and we'll take care of you.
Those patients at Wishard
Yes.
who have traditionally had Health Advantage,
Yes.
Will they be able to go any place to either what Brian has just, any of his facilities, any of the Wishard-Eskenazi? Will they be, if they have Health Advantage, that will take them any place?
Yes. Now that's going to be probably a year from now. You know, we're working
Okay.
on all this. We're working to.
We understand. You're still working out the details.
To get the details, and that involves a lot of back office integration. You know, we're going to have to get our IT systems talking to one another and our scheduling systems and all those that groundwork. But that's what patients are going to see. But here's another great thing. Many of those patients that are what we call Wishard Advantage patients now, in 2014. When the next phase of healthcare reform comes, many of those patients now are going to have the opportunity to have an insurance product. They're going to be able to purchase that product with these, what they call exchanges, where they will receive very significant subsidies or even free insurance from the exchanges, or be able to take advantage of the Healthy Indiana plan or other Medicaid programs. And so they're going to be able to have that choice. And we want to make sure that when they have that choice, that they've got great options to exercise that choice. And by us coming together, that's what's going to happen.
Right. So that in the end, and it probably is close to a year, regardless of you have Medicare, Wishard Advantage, Medicare Advantage, Medicaid, Medicare, commercial insurance, whatever it is, you'll see us branded as one, and you know that you'll be able to receive care there. And the idea is trying to get a relationship established with some sort of a primary care physician that can help coordinate that care throughout our system.
Okay, what is the benefit for Wishard-Eskenazi Health in working with the Community Health Network?
Well, there are fantastic benefits, really wonderful benefits. As I said before, Community is a great system. They provide really high quality care. They do some things better than anybody, period. They've got wonderful behavioral health. They've got a tremendous primary care system. They've got great locations around Central Indiana. And so when you put our two systems on a map, they really fit together really wonderfully. And so we've got a partner that is really focused on patients. But it really, let me take a step back. It starts with something I think more important than that, which is Community's values and their mission and their commitment to patients. Community started over 60 years ago on the Near East Side because there wasn't a hospital in that area, and it was a community that had very limited access to health care, and some citizens came together in this grassroots effort to say, we want to make sure that these people in this area have access to quality health care. And so from that core value of just meeting the needs of everybody, and then remain committed to that, that is from that value that makes them such an important asset to our city as a whole, and makes them a wonderful partner for us.
And likewise, Brian, what is the benefit for Community Health Network?
There's a number of things, Ruby. I mean, one of the real tangible ones, and people are always saying, well, tell me something specific. Well, we've contemplated, does our North facility, which is our flagship, need to be a trauma designation? And we've had a lot of conversation about that. And we believe that we may have a day that we must be trauma designated, but we're not now. With this partnership, we have a partnership with a trauma center, a very good trauma center and burn center. So the idea of doing that's one instantaneous benefit to the community, because one, we have that relationship, but two, the cost of having that on an ongoing basis is tens of millions of dollars a year. So we'll avoid those costs, which means the community, small c community, is avoiding that cost, and we don't believe that there's demand for another trauma center in the area. So that's a real tangible benefit.
Absolutely.
The other thing we get is this, and this is a little bit repetitive for what Matt said, is it's this focus on primary care. It's at the basic part of, okay, primary care, how do we see that? And we're complementary. So we're Wishard-Eskenazi, their facilities are, we're primarily not. And so so the idea that we could have this net that would provide services throughout Central Indiana was wonderful for us. The other thing that Matt talked about was the history of Community East and how that started. What's really interesting, though, when you look at our other partners, Community of Anderson, Community at Howard Regional, Community Westview, those are all places that have the exact same story, just a different year.
You know you're going to lose, Brian, when they open this beautiful hospital out with the Wishard-Eskenazi. I guess it'll just be Eskenazi then. Everybody's going to be wanting to go to their new hospital.
Isn't that fabulous? I mean, it's a beautiful, beautiful place.
Absolutely.
And I've had the detailed tour. I actually feel like I was part of it. I wasn't, but Matt's given me a great tour, and that's the other benefit. Okay, so I said we have locations throughout. We don't have a downtown location. We don't have a location that can serve the inner city population. And I don't mean I mean the working population, the consumers here. And so how do we work to make sure that we take this prized jewel and we make it all that it can be?
So it's a win-win situation where people that have traditionally had only Wishard to go to, being in the inner city and not being able to go to outlying places, and then now they have both.
Correct.
So now that you are expanding, the services for people who will be able to go to many locations and receive their health care, will any of your existing facilities be closed, or will any employees lose their jobs?
No, this really gets back to my earlier comments that with healthcare reform and the expansion of coverage, we know that there are going to be more patients that we need to serve, more demand on the system, and so we're keeping all of our doors open. In fact, we're really getting ready for a greater influx, so we need all hands on deck for 2014, 2015, 2016. Let me make just one other brief comment about the timing. Community is not only a great system, it's a strong and vibrant system. Wishard-Eskenazi today is probably in the strongest position that we may have ever been in our 150-year history. These are two systems that are very strong and very vibrant, coming together to even do more jointly than we can do individually. But the advantage to that also is because we are both in a great strong position, it gives us the opportunity to take the time to plan and integrate very thoughtfully so that we can serve the community in the best possible way.
I know that Community has many other affiliations, many other partnerships, so to speak, and so does Wishard-Eskenazi. How will this partnership or this relationship affect those facilities that have existing contracts or affiliations with you?
It makes them stronger.
Yeah.
I mean, we didn't do the partnership in a vacuum. We've included our affiliates, we've included our other partners in the discussions, and each one has said, that's great. Man, that's good. This expands what we can do. You get back to the jobs, the demand is there. I mean, we have a standard in our network that anybody should be able to see any place that we operate for any reason, regardless of ability to pay, within 48 hours. That's the standard that we have. We don't always meet it, but that's a goal. That's the standard that says we need to be able to we're open for business. We have to have the ability for patients to access and they know they can get in. We don't run out of patients doing that. We don't run out of need of the consumer trying to get in. So we just this is a way for us to take a funnel that's like this and we make it like this. And when we make it like this, we're going to continue to provide more care and we'll go like this. And if we do that both with limited resources and a more effective management and less duplication, then we can just provide more care. That's what we're trying to do.
How will this relationship affect the Marion County property tax map?
Well, it'll really take that. It will not raise property taxes at all. In fact, at Health and Hospital Corporation, we've actually either maintained or lowered the property taxes now for 9 consecutive years. And so what this does is take that amount of property taxes that we get, which we are very grateful for, and we would like to suggest that we use it very wisely, and so take those property taxes that we currently get and stretch them even further. Make even greater use of those property taxes, give even greater value to our local Marion County property tax payers for those services.
So, and likewise with community.
The property taxes are not an impact to us.
Oh, that's
we
right.
Don't, we don't receive
you're right.
That's why I let Matt answer that question.
Yeah. Okay.
But that does raise an important issue that's probably worth clarifying. That this is a marriage that's happening, but Health and Hospital and Eskenazi is a government hospital. Community is a not-for-profit, and we'll stay that way. So it's not actually a merger. We're not actually taking our assets and combining them,
right?
Because there are very real benefits to us being a governmental entity. There are very real benefits to us being able to leverage federal money, state money, bringing valuable resources into our community, and so we don't want to lose that. So we're structuring this arrangement really as a true collaboration, a true marriage. But it's not a merger, so we're staying a governmental entity, they're staying a not-for-profit.
Absolutely. Okay, we've been talking a lot about this. I'm sure that you've been on lots of news shows talking about when will the public see the first sign that this is going to be rolled out, and when will your employees see that this is a first sign that the partnership or the relationship has begun?
Well, we want to do it as soon as we can. We really do. Healthcare reform is coming in 2014, and so our goal is to be ready by 2014 when the exchanges open and there becomes greater access. So that's our goal. It's going to be incremental. There's going to be some things we can do sooner, some things we can do later, and it's an evolving process. But we feel the need to be moving as fast as we can, but to also move responsibly, and so we feel good about that.
So healthcare reform has really changed the face of how you provide access or how you provide healthcare.
Without question. And when we said when we signed our initial agreement, we knew it was going to take some time because it's very complex. And we had said that we would get all this wrapped up before the end of the year. We hope to beat that. And we'll be glad to come back, Ruby, and tell you about all the things that patients can see.
All the things that you have worked out,
as soon as we have that. But we don't want to mislead anybody.
Okay, we just have a little bit of time left, and if I could just get a quick update from you, Matt, on are you on schedule for Eskenazi?
I am delighted to report, thank you for that question, that the new hospital campus, the Sidney and Lois Eskenazi Hospital, is on schedule and on budget. We are going to start seeing patients on December 9th, 2013. It's going to be a great day. It's a hard opening. In other words, we are going to throw the switch, and all the patients that previously were in the old Wishard Hospital are going to move over in one day to the new Eskenazi Hospital, and all new patients that will arrive at that new hospital. And we are so excited about that. You're going to see a number of opening events of some real public celebrations in November of 2013. So we're going to have a great open house and a ribbon cutting and a lot of celebration because the community is this is their hospital. They've really backed this, and so we're excited about that.
It's beautiful. It's coming along.
It is. It's fun. It's been fun to be a part of, and we're excited to have it open on December 7th.
So this it will be a good time when when Eskenazi Health opens to get this partnership up and going.
Absolutely.
It sounds like a wonderful, wonderful relationship, and everybody's going to benefit from it, especially those our patients in Central Indiana who have like I said, traditionally only had Wishard to go to, and now they can go all over the city and receive that help.
You got it, Ruby. That's exactly what we're trying to do.
Thank you both for joining
Thank
us.
you, Ruby.
Also, I'd like to thank you for joining us for Focus on Health. I'm Ruby Gross-Didier. We'll see you next time.